Now, question for you all. How many of you in this room have not heard of something called ChatGPT? Show of hands. One person, you've never heard of it? Well, get ready. Oh, you have heard of it. You're messing with me? I can't, there's a bright light in my face. I can't tell. Well, if you have not heard of it, get ready for your mind to be blown. Chat GPT is just such a huge topic right now, and it will continue to be. In fact, our next panel has a lot to say about it. Have you ever wondered why doctors are eyeing ChatGPT warily as Google takes a back seat? Today, our panel will provide clear examples and expert analysis on how ChatGPT's rise has the potential to affect healthcare. And ChatGPT is, of course, artificial intelligence AI. Get ready as we cut through the hype and examine the real impacts on medical practice with our team of experts. Please help me in welcoming to the stage. Let's first call our moderator, Anthony J. Nelson, founder and managing partner at Growth Culture. Come on up, and we're going to take the discussion forward.
I got to, like the last slot of the day again. I did men's mental health. I feel like everybody was like tired at the end of the day, so hopefully everybody's carved up, has some energy. But I think this is a pretty fun panel. So I know it's about ChatGPT, but we'll talk more about that because we think, in talking to the panel here, we've got some clinicians, we've got some cybersecurity, we've got some people developing intelligent automation. We think of, ChatGPT is this concept that everybody thinks about really readily, but we kind of think about on the clinician and patient side of the ability to improve access to care, improve patient outcomes, but also the data integrity that we think about. So I think we're going to take a little bit of a different spin on it and not just ChatGPT, but let's talk AI overall, because I think we can all agree that, you know, Anthony shouldn't be going to ChatGPT to diagnose why his breath is bad today. Like we should actually be using ChatGPT for different things, but we can actually use AI to accelerate other things in healthcare. So I know I got introduced. My name's Anthony, founding managing partner of Growth Culture. Obviously thrilled to be here. It's been an amazing conference. I know Charles, you've been here before. This is my first time. But by way of intro, so I've been on the commercial side of AI for about 8 years now. I actually took Optum's NLP to market back in 2018. And I started my firm because I saw this opportunity to help folks like Evidence Care and others think about if we're going to bring AI to market, how do we do that at scale in a very elegant way so that these companies that are kind of really forging the path forward to better patient care and better clinician lifestyle. How do we make sure we're doing that in a very, very elegant way? So I figure we kind of bucket this into a couple of topics around, eliminating mundane or provider activities. We'll talk about providing care at scale, and then we'll talk about like data integrity because I think of clinician adoption and even like patient skepticism around like how doctors are kind of treating people are kind of like the key buckets that we'll talk about. So I figured we would start with eliminating mundane tasks for doctors. And Brian, you've got a very unique perspective on this being an ER physician
Yes.
and going through what I refer to as the paper towel roll of patient notes.
Yeah. Um, so I want to start off with just sort of definition. We all hear the term AI a lot, and I think a lot of folks think of artificial intelligence when they hear the term AI.
Right?
But the American Medical Association just put out a paper a few weeks ago, and the definition they used was augmented intelligence,
Hmm.
because it can be lots of different flavors. It can be machine learning models, predictive models, um, scoring systems, and the whole goal is to help providers deliver better care to their
Yeah.
patients. And I'm going to steal a line from one of my friends. His name's Dr. John Handler, who's the innovations in residence person at OSF Hospital System. And he said to me recently, there is a tsunami coming that most providers don't want to acknowledge, but it is coming very quickly, and it is gonna change healthcare. It is gonna change provider workflow, and I think for the betterment, because today there are too many administrative tasks that providers have to do.
Hmm.
Um, and that same American Medical Association paper said that 2/3 of physicians are looking forward to AI, And what they're really looking forward to is automation of those mundane tasks
Hmm.
and making so many of the things that they do that are administrative easier for them so that they can have more time
Yeah,
for patient care and to
love
spend
that.
with their patients and to have the art of medicine. And so the example I had shared with the group via email was I can remember when I was a resident and I worked in the ICU, and patient who'd been in the ICU for a month was ready to be discharged, and I had to get 6 5-inch thick binders of papers, and I had to go through, and it took pretty much the whole day having to go through that chart to write a discharge summary,
Mhm.
which today, the EHRs can literally do that in a minute
Mhm.
and consolidate and compile and aggregate and summarize that patient's visit. And so that's just a simple example
Mhm.
of where these tools,
It's
can help providers.
like the tip of the spear. Like,
Yes, yes. Easy example, but that's just
yeah,
one example there of
I love
where.
it. And Heather, you've done some amazing work at Brigham and Women's Hospital, very reputable. But I know you have a tremendous background. As you were actually explaining to us out here about trying to create a version of yourself to kind of provide care, and that's a little bit more of like taking some of the burden off you. But I always think of that as if we're taking some of these like mundane tasks away from physicians, that allows you to provide higher quality care.
Yeah. And not only higher quality care, but potentially higher volume of care. If I
Mm.
can work while I'm sleeping, that's actually kind of the goal, right? So, what we've been trying to do at the company that I'm a co founder at AI is actually turn me into an artificial agent, if you will. So, I specialize in midlife, women's health care. It's an area that's actually been quite underserved.
Mm.
So, we have millions of women searching for questions, just endless questions about midlife, menopause, hot flashes, hormone therapy. And since I get so many of these, I, started to think to myself, how could I actually help more than 8 people a day or 20 people a day? That's just not enough compared to the millions of women that need
Yep.
support. As I was thinking about actually laughing about I was at the very end when we didn't have an EMR, so I only had a year of paper charting. But one of the bane of my existence is my inbox. I get so many questions as a primary care doctor. So I was actually just looking at it before I came up here. I said, okay, after this, I've only got 20 messages to answer. That's not too bad.
Yeah.
But what if I actually had an artificial agent that actually was me in my own brain that could actually start answering those questions for me?
Mm.
Hmm, that would be fantastic.
Yeah.
So I do think that AI is going to be imperative in helping clinicians get through the workflow, the volume, while still having some satisfaction what they actually do and good quality of life. And I do think that it is the only way we're going to be able to serve the millions of patients that we have.
Amazing.
Yeah, there's a huge supply and demand problem.
Amazing. I'm actually going to hop down to Adam because your company's doing something I think pretty. I was doing actually. I know we didn't really talk much, but I did a little bit of research on your company and intelligent automation at scale. Pretty powerful stuff. Let's hear a little bit more about it.
Yeah, so we think that there's a lot of the rails already created for healthcare interoperability. Plain English, it just means that hospitals can talk to each other really well. But the issue is going back to the point of the huge packets of the discharge summary, if you already have that right in front of you, it makes it really difficult to find time to go through all of the surrounding information on a patient.
Mhm.
So the whole thesis of our company is that there's a huge opportunity to make sense of the entire world that is a patient. So there's the things that come to a physician right before they see you that's within their own system, that's directly in the referral that they received. But we try to actually find the entire longitudinal history of the patient of everywhere that they've been, and then use an LLM to turn it into just what matters. The reason we have to do that is because a patient's history on average is about half the size of Hamlet, and that's just unsustainable to do for all the people that you have to see every day.
I love that. Guys in the middle. Let's talk about security of this stuff too. So let's talk, like of course we can do this all we want, make sure that it's scalable for providers and we're going to provide good care. But what about the security side and making sure that that data is actually accurate?
Yeah, it's kind of a security nightmare in many ways. And my company, Hale Consulting Solutions, we do project management, cybersecurity, and regulatory compliance. And the regulatory, everybody talks HIPAA. HIPAA was written in 1996. The AI didn't exist. Cell phones practically didn't exist.
Right.
So the regulations are way behind it, and it's going to be some time before they catch up. Definitely not going to catch up in an election year.
Mhm.
Um, so that's part of our concern. But just overall security, it's understanding where your data is going when it's going into this data model. The poor engineers at Samsung that uploaded their code to ChatGPT to see if there were any bugs in it, not realizing they just published their code to the entire world. they don't have jobs anymore. You can imagine doing that with a patient medical record. So, and Adam talked about interoperability. This has been a hot topic. It's huge in California. Is being able to provide all of this data to everybody who needs it in a timely manner. So you've got a complete medical record, and then as your company's doing, being able to make sense of that complete medical record. The security side of that is how do you make sure that somebody else doesn't get all of this information and being able to do this in a secure manner. And honestly, we're a little behind the tidal wave on that. And we're playing some catch up, as you can see with the news almost every week
Mhm.
in some breach or another in the healthcare industry.
Yeah. So we've got ideas, we've got security. What about the accuracy of this stuff?
Now, the accuracy of it, yeah, I mean, you want to make sure that we've all heard of, those of us who are familiar with AI and ChatGPT, hallucinations.
Mhm.
These large language models were made to respond, to provide answers, and they go to great lengths to provide an answer that may or may not be real. And so the need for human oversight and to not just let these things go wild. I use ChatGPT and several other AI, enabled tools within my own organization, but there's always somebody there to check and make sure, okay, it did a good job. Don't just publish this to LinkedIn. Don't
Yep.
just, load this out, send this status report to our
Yep.
clients. It requires a certain
Mm.
level of human oversight. And having worked with it, a certain level of you have to know what you're doing. I
Yeah.
mean, they say, this is going to replace jobs. No, you still need people who know what they're doing to tell the AI what they want.
I was having some conversations recently where it's, is it going to replace people? Maybe not. But I think the people that are actually embracing it and know how to like deploy it in a very elegant manner, we are going to see a separation from people. Andre, you brought up this this concept that I never even heard of, which is an F score. You want to talk about that a little bit? Because I think that ties into the accuracy and what we're talking about here.
Yeah, yeah, and practically, so to give you guys some context here, Intelligent Medical Objects, the company that I work for, we provide foundational terminology for about 95% of the U.S. healthcare market. So as docs, like the ones over here too, are talking about documenting in the point of care, doctors, if you were to ask them what's the SNOMED code for hyperphosphatemia, they'd be like, what is that? Right. So IMO, as a company, we help provide bridging that gap for clinicians to speak clinician, and we take up all the coding guidelines behind the scenes. Um, in practice, though, as you think about either ambient listening or evidence-based operations to help in throughput operations, the concept of entity recognition as part of free text understanding is something that a lot of times organizations cheap out on,
Yeah.
and that's a problem when it really comes down to it. Because if you're trying to train your models, let's say on accuracy using UMLS's Metathesaurus, in statistics, if you look at gold standard use cases, you're probably only 80% accurate in your entity recognition of information, and that'll only help for your 80% of the population, representing 20% of the cost of care. But if you're getting into that 20% of the population that represents 80% of the cost of care, you're dealing with a lot of multi-morbid, domain specific patient populations, and truly understanding the data inside of their information sets. A lot of times codes don't touch. So unless you wanted to say, hey, your rare disorder is a other specified genetic disorder that's well known, like that's something that it's a code that's out there. But to anybody that's out there, you have non-refractory Hodgkin's lymphoma. There is no code for that.
Mhm.
And that's a problem when you're trying to understand patient populations, when you're trying to help clinicians be more efficient. If you're prompting the clinician to say, hey, this is the code that you're looking for, or you're trying to say, hey, patient, if this is how you're understanding your rare disorder as a other specified disorder, they're like, no, I know what it is. Tell me what it is in my language. So when we think about F scores from both a data quality perspective as well as from a usability perspective, we think about it as like how are you referencing the patient's understanding, and how are you referencing the clinician speak appropriately for any kind of data operation? And that's no one's getting close to it in any kind of
Love
model
it.
that's out there.
Love it. Z, thanks for joining us. I think it seems like you guys are getting close on some of this stuff with some of the things you guys are automating. Talk to us a little bit more about what you guys are focused on.
We are getting close, and I apologize. I don't have a microphone, so I'm going to try to
Just
speak
speak
a little
loud.
bit loud.
Just yell.
We're getting close. And the accuracy, there is a challenge there with the accuracy. However, there are specific data sets, as you were saying, out there that are publicly available. What I found is when we're using specific data sets from the organization or the healthcare network or the hospital network that we're looking for, sometimes the use cases are pretty narrow. So if you match the new use case to the specific data set, we are, I've seen above upwards of 96% accuracy, and that in the health of patients is not enough. We want to get to that 100% point or 99.99% point. So there are manual checks that still require to be done, and there's scoring, and there's weighting, and there's QA that needs to be done still, but it's getting a lot better, and there's a lot of promise that I've noticed.
And when you, so I'm actually see, I'm going to stay with you and we'll kind of work our way back a little bit is like kind of the next bucket we were talking about is like a lot of this is actually like giving providers the ability to provide better care at scale. And when you think about the work that you guys are doing at Odesso, how does that tie together?
So one of the challenges that are happening in the marketplace right now, for example, is the scaling of primary care networks, right? So, for example, CVS is now not just a pharmacy; it's a primary care facility.
Right.
Right? You go into CVS, you see your primary care physician, you get your prescription, you go to the pharmacy, you get your drugs, and you walk out. Right? It's a one-stop shop. That's happening with the Rite Aids, the Amazons, any retailer, brick and mortar or digital, is going in that direction. And so, what that really means to us is scale. So these small physician or primary care networks are now being bought up by the larger ones, and so the scale really matters here. And so, to be able to do medical coding, to be able to do other areas where we have data heavy operations,
Mhm.
becomes very important when it comes to the matter of scaling, right? And so, using AI as much as we can, technology, automation, digital automation is a very good way to augment and help collaborate with the clinicians.
I love it. And then Adam, like, how do you think about this as, we've talked about the provider side, but how is this work actually going to like impact patient outcomes?
Well, I mean, one, the providers can be way more informed going into a visit. So there's a monetary aspect of this as well. You're able to risk patients a lot better if you can find every valid comorbidity and diagnosis, and AI is very, very good at that. But two, if you know about these things coming into a visit, the patient's going to benefit quite a bit. So if somebody's diabetic, you might put them on a significantly different care pathway than if they weren't. And if you have the patient's full record and can go through it very quickly and service that at the point of care, over time, you're going to find more and more of these different care pathways that are administered, and it just kind of helps out everybody. The other piece is just that the doctors can spend more time doing work that they actually enjoy, which I do think makes a much more favorable experience on a personal level for a patient. If somebody doesn't have to go home and be on the EHR for 3 hours after the day, I think they're going to be a lot more happy to see you, and you're not going to feel as it's not going to feel as transactional. So just keeping doctors doing the high value work that they enjoy is huge.
I love that. And then Andre, in the email chain with all of you said ChatGPT does a very terrible job at evidence-based recommendations for care ops. Tell us more about that, because that is clearly, if you have a good care operations infrastructure, you can provide better care plans to the patient. So when you think about how all of this ties together, give us some recommendations about it.
Right, right. So, so two stories I'm going to tell you guys. So, one was a family member of mine. She had stage one estrogen receptor positive breast cancer, progesterone positive, HER2 negative. To any clinician that's on the team here too, everybody knows that that's a patient's diagnosis. From a coding perspective behind the scenes and how evidence-based trigger methodologies for care plan operations work, they'll look at both the unstructured side as well as the codified side of the equation, and that will kick off a workflow behind the scenes. Now, in this case, if you're starting with a large academic medical center like my family member had gone through, estrogen receptor status did not come along for the ride in an interoperability statement. Progesterone status did not come along for the ride in an interoperability statement, nor did the HER2 representation of that information. So, in this case, with this patient, as she went to to get a referral for a cystic acne, she had an estrogen receptor or an estrogen topical ointment being prescribed to her. Payer approved it. The health system medication double check didn't follow through with it, and that my family member, we had to train her to literally say, ask every doctor that you go forward with now going forward, is this a estrogen treatment medication? And that's something that we shouldn't be doing as an organization. And if AI is being trained behind the scenes looking at coded representation of information, it's going to be always problematic because it's always going to be trained upon what is representative of the data set, not what is truly understanding of what's going on with the patient. And these are always going to be problems until we get better at understanding that data set.
I love that. And then Charles, security side, very important.
Yeah, I mean the security side is very important. I mean, people ask me, why are we always seeing news about somebody getting hacked in the healthcare industry? Well, let's face it, we've got patient identifiable information, we've got financial information, and we've got health information. This is a gold mine. And when you look at the cybersecurity actors, this is based on some reports last year a $1.2 trillion industry.
Crazy.
So we're talking the cybersecurity or the cyber criminals is bigger than some countries. They have the resources. So of course they're going to target the high value targets. And
As is going on right now, like
as
in the
is
news
going
right
on
now.
right now.
So,
Um, and they've actually, and we've seen that they take this personally identifiable information, and then they'll say, okay, we're shutting your systems down. You have to pay a ransom, or we to get them back. Oh, and by the way, we're now going to reach out to your patients and say, hey, Charles, we found this in your medical record. And unless you want everybody to know about it, you're going to pay a ransom too. So it's getting ugly, and so that's why we look at things like encryption, like blockchain technology, actually, as ways to decentralize and secure this information so that the information's out there. It's harder to steal because it's not in one place. And at the same time, it's still accessible via the interoperability that everybody who does have the rights to it can get access to it.
yeah.
That's kind of forward looking. We're not there yet, but that's kind of the direction that we see the industry going, is more towards a decentralized data solution. Our biggest hurdle to that is data is money.
Mhm.
Everybody wants to own their data so they can make money off of it.
Yeah.
And making decentralized data, I mean, we've seen it. AI really supports this. The more data, the better. But then we see all these lawsuits against open source because, oh, you made our data available to everybody.
Yeah.
So
Heather, Brian, from the clinician side, providing care at scale. Heather, you're doing some amazing work, but Brian, actually, so from the primary care side, I want to hear how you guys think about care at scale with AI, but also Brian, we'll talk about the kind of like the in the ER, ICU. But Heather, talk more about this version of you that you're creating, because I think it's especially like the niche that you focus on, which is
Yeah.
women's health
Yeah.
and things like that. How are you guys providing better care at scale with AI?
Yeah, so this is a great question. When it comes to midlife women's health, which I said it's been underrepresented, which sounds crazy, but it has been underrepresented for a really long time. You have, such a supply and demand mismatch. So there's 67 million women in the United States alone between the ages of 35 and 64. And of all the menopause doctors, there's about 2,000 certified menopause doctors.
Jeez.
So the math there doesn't really math. There's just not enough clinicians to meet the need, the number of questions, the help and support that women need. And that's just one example. I mean, you could say the same thing for several other. I mean, I can't imagine how busy the emergency room is in Las Vegas. There's just not enough clinicians. And so you have to allow clinicians to work at the top of their training, which is to provide the clinical care, answer the questions, make sure that they're not quitting their jobs and leaving and moving to Costa Rica. So you need to make sure you take burden off of them as well, that they like their job. But even if you do all that, there's still not enough doctors. There's just not enough.
Mhm.
And on top of that, a lot of women or men, want to see an expert in their field. Nowadays, social media doctors are becoming pretty much the thing. I think everyone knows who Peter Attia is, right? So what if you could just open your phone and talk to Peter Attia? That would be pretty cool.
Pretty cool.
So essentially what we're trying to do is replicate that and allow there to be a way that people can talk to the doctor that they really want to talk to in a way that's safe and in a way that helps to support bridging this gap of supply and demand mismatch.
Yeah.
And I think the interesting thing is, I think on the surface, the assumption is that this is very impersonal.
Hmm.
This is, something that's going to take the care away from healthcare. But the studies actually show the opposite.
Totally agree.
Studies show that patients are more open talking to a computer than they are talking face to face with their physician,
Yeah.
because then that's a person that, and how are they going to judge me? And I want to ask this question, but I don't really want to ask this question. Or I have this thing I've always, not shared with somebody. But with a computer, they don't feel that, and so they're more open. And then the other side of that, in terms of, the EHRs are working on, mention inboxes and generating automated responses to inbox messages. And they actually found that the AI generated responses, the patients felt that they were more personal and warm
Then,
than the physicians.
which is
Because
usually 3 words. This is
because the
fine.
physicians was yes, you're okay. Whereas the AI model generated, hey, thank you for reaching out. I hope you're doing well today. And the patients actually appreciated the
Wild.
AI
We
generated
see
response.
this in our
The AI is like empathetic.
Yes,
yes,
more
yes.
empathetic than the
This
physicians.
I cannot agree to that more.
Yeah.
That's what we see also.
Uh, and Brian, so like I know we didn't talk about it. I was just thinking about it. It's like you were an ER doctor,
Yeah.
ICU. Like AI probably helps you with like your workflows, right? Like a patient, comes in and you can get through that stuff a lot quicker. But I know we weren't going to talk about ChatGPT, but what about people like as you think about like if I'm a patient, I come in and I've got road rash from a bike crash. I did a bunch of ChatGPT and I'm coming in kind of pre-diagnosing myself. Like, how do you kind of overcome that?
Well, I think the way, so I'll shift it a little bit to what we're doing with evidence care,
Sure.
because I think one of the challenges in healthcare is, the EHRs were needed, they were mandated,
Yeah.
and they were good at what they were, which was data repositories, but they never really helped physicians take better care of patients.
Right.
And so that's where, we've created our platform to be something that integrates into the electronic health records,
Mhm.
pulls data about the patient, and then is able to surface treatment recommendations, insights, nudges, so that it's giving the physicians that cognitive support
Hmm.
that they need, so that they're still making the decision, but they have more information and better information to make those decisions off of. And decision fatigue is an issue in healthcare. All the studies show, the decisions that are made at the beginning of a shift or the end of the shift or the next day after residents been working 24 hours, there's there's fall off
Yeah.
in their accuracy. And that's where they need these tools to help surface those recommendations and insights so that they can consistently deliver the best care.
Better care integrity. It's
Yes.
amazing. Heather, what do you think about that?
I mean, that sounds absolutely on point. So I think that really, essentially, what we're sort of asking is this a good thing for clinicians to embrace? And
Yeah.
the answer is yes.
I love that. And then Charles, one thing that kind of comes to mind with your background is, if I'm a company, maybe, if I'm evidence-based care, it's like I have to position in the market to be trustworthy for clinicians. I need to be trustworthy for patients. How would you recommend companies kind of dispel that belief and even like dispelling that like, kind of like hesitancy around AI for the clinicians that aren't ready to adopt it or patients that aren't ready to adopt it?
Yeah, I mean, first of all, is transparency.
Yeah.
So, don't try and hide the fact that you're using an AI. It's that can backfire on you horribly. Um, and also being aware of the regulations going forward because they're not there yet, but they will be.
Yeah.
So, you don't want to spend $500 million implementing something that next year is going to be illegal. Um, so that's part of it. But as far as building the trust is, eh, I see an opportunity here with AI and with big data and with interoperability that one of the biggest things that we see in the HIPAA regulation realm is patient right to access.
Yeah.
And there's fines, there's problems. This is just a very difficult area is how do patients get access to their data and how do they request changes to it?
Yeah.
Now we have the opportunity to give them that access in a readily, available way, um, in a secure and private manner, of course. But it's actually solves one of our biggest pain points in the regulatory realm, and that's around patient right to access.
I love that. I love that. And then Andre, when we think about care integrity, you're clearly a deep, deep wealth of knowledge on this stuff. What do you think about when we think about care integrity, AI, whatever modality of AI we're talking about, whether it's LLMs, ML, NLP, IoT, care integrity, like how do you think about like cracking and like making sure that's super solid?
Yeah, I mean, all of it comes from trust. I think that's a common thread that's been identified here too, because and it's interesting. I just came back from HIMSS last week, so if I could have rebranded HIMSS, it would have been like HIMSS AI because 95% of the companies, yeah,
It's the whole thing.
it was the whole thing. But the underlying tenor of all the clinicians that were walking through were, well, how are you proving to me that this is trustworthy of what you're actually doing behind the scenes? And I think like everyone's identifying here too, there's meaningful chunks that we can address in the short term. Urgent care, immediate care could probably be an easy triage operation today, but as we go into high cost, um, long-term treatment operations, like let's say in like cardiology, neurology, uh, I'm not shoot, what's the word I'm looking for?
Oncology?
Oncology, thank you. those are going to be really, really difficult to manage over time because genomics can get thrown into the equation, different data points can get thrown
Yeah.
into the equation, and that is a knowledge base that's always going to be changing almost on a daily basis. So making sure that the models are also trained up on it, but that the organizations that are providing those models can prove that trust is always going to be a key piece. That's always going to be a moving target.
I love that. And then Adam and Z, it's kind of like a perfect segue into like, as you guys are building like amazing, amazing companies, what are you guys doing to make sure that we're holding up that integrity of care, the practice of medicine, all that stuff? And feel free to chime in on anything else too. But I think as you guys are building these really amazing kind of automation platforms, there's, as CEOs, you guys always have kind of the patient and the provider at the center of everything that we do.
No, yeah, it's huge for us. I mean, we go up to these huge hospitals and we're asking them to do a fundamentally new thing, so we got to be trustworthy. The ways that we've done that is engaging academia. So we started working with Duke University to put out a white paper on how we do benchmarked against humans and how we're able to change clinical outcomes. More and more of these papers are coming out, especially over the last like 3 months or so, and things have been looking really, really encouraging, which has made it so that tools like ours can get more and more adopted. On the product level, what we do is make sure that every single thing we generate comes with the exact source that it was made from. The nice thing for us is a tool that kind of takes the patient record and figures out what matters within it. Is the answers to the tests are in the original patient record. So you can always take the summarized output and compare it and say, hey, is this diagnosis a completely new word? The other piece of it is at any point within our product, if you see something that you think is questionable, like we give you a timeline of everything that happened in the patient's pathology history. Just click that part of the timeline, it'll go to the original pathology report, and you can make the judgment for yourself. So in a lot of ways, I wouldn't look at tools like ours and a lot of other tools that are using things like RAG as a new piece of information. It's almost like a table of contents to existing information. You look at things like Perplexity AI, it's something that's taken a lot of share from Google. It's all about being able to show all of the sources in the response, and then you can just check for yourself and not really have to go off of it and trust like an AI output. However, we are seeing extremely encouraging results, especially in like summarization, where the AIs are far outperforming medical experts. So that's been encouraging.
Amazing. And then Z.
Yeah, trust is number one always. Trust and transparency, as everyone's echoing on this stage. We're at that cusp, and in collaborating with a very intelligent technology, and it's really important to be able to establish trust between humans prior to engaging with this technology. Is number one. And as you're doing with the hospital networks, we're doing with the EMRs. We're very well integrated with the EMRs and have collaborative papers out with them, and just establishing a domain expertise and demonstrating trust with that as well. As more on the automation side, there's a very simple a winning strategy in play here, right? With bringing in ChatGPT or like technologies, different models to be able to serve patient outcomes. It really boils down from a workflow perspective to accuracy. The more accurate your data, it's a win-win for everybody involved. The other is efficiency. The quicker you're able to get things done accurately and with quality, you're winning.
Yeah.
Everyone's winning. And then the third is with cost. If you're able to reduce the cost, you're winning with the same level of quality, if not higher. And if you're able to demonstrate all three of those, you're put in a pretty strong posture, whether it's clinicians you're dealing with or technologists. And that's what we demonstrate, right? And it's measurable. If you can't monitor it, you can't measure it. You instrument it every layer of the path. You do QA checks. You're totally open and transparent with the data, and then you show that you're winning with accuracy, and that you're getting better accuracy than you do with a clinician sitting behind a computer going through these medical records than an AI going through it for 80% of those use cases, not the 20% complex ones. If you focus in on those specific 80% that are fairly, I'm not going to say simple, but just more of the straightforward ones that ChatGPT performs well on, you can get really, really good accuracy, better than human performance. And similar with the efficiency, the quality, there's no bot sitting there or AI algorithm sitting there getting sleepy on a Friday night.
I
That
love
does
that.
not happen,
Right, like you were
right?
saying.
Nor do they go to sleep. They're working 24/7. They don't have to drink a coffee in the morning to show up at 8 a.m. And finally, the cost is undeniably much lower
Mhm.
right,
Love it.
from a compliance standpoint and just from an hour standpoint.
Yeah. And then I think we'll kind of wrap up and then we can kind of open up to the floor if there's a couple of questions. But if, we'll start with you, Z, like just one quick power statement of like, what are you most kind of excited about with the advent of AI coming in healthcare, whether it's ChatGPT, LLMs, neural network models, whatever it is. What are you most excited about? What should we all be like really excited about for the future of medicine?
I'm really excited about it taking flight with it. At this point, it's somewhat consumer. If you think ChatGPT, I think a little consumery, right?
Yeah.
It's a little gamified. I'm really excited about taking it from the 90s into the 99.99, like similar to what Boeing would do when they're building a jet. There's really no room for error here, and that is a novel challenge. That 4% that we're working on is all the work we've been doing in the last year of our building our software is that 4% accuracy. And I'm really excited about
Awesome.
beating that curve.
I love it. And Adam, what about you guys?
I just want healthcare, being a doctor, being a nurse, to be a job that people really, really love, and they don't feel like they got duped when they go into it because of the EMR. That's it.
Love it.
Um, yeah, and I'm really excited to make sure that as we keep the patient as the center of the care operation here too, that patient story is known and modeled appropriately forward, so that any person on the care team can actually understand what's going on, take action to it, and truly understand it. I mean, practically as we think about I bring it up every once in a while when I talk about advancements in technology, but we think about the Star Trek conundrum, in the future, hopefully we might have the computer just, identify what we need to do. We're far from it, but I don't know, I kind of see that's where the football's going.
Love it.
Setting aside security, privacy, all that stuff. As a patient, I am excited about seeing what's going on. Because right now I don't know necessarily what's in my medical record or what it means.
Mhm.
And so the opportunity that this presents for me as a patient to say, or my caregiver, if someone's taking care of me, to say, oh, so Charles went last week and he had high blood pressure and it doesn't look like he's been taking his meds. We need to talk to him.
Mhm.
Things like that. I see this huge opportunity as a patient
Yeah,
to improve my own healthcare.
I love it.
I love that response.
Yeah.
I actually am like thinking about we're physicians. I haven't seen a physician myself in like a really long time. So if there's some kind of technology that can help me, that would be great. I always said my mission is to help millions of women. And without this kind of technology and all the security and all the things that you guys are doing to pull all these things together, with that, I might actually be able to achieve my dream.
I love it.
So I'm
Amazing.
excited for the future.
Yeah, I think the future of medicine is exciting. I think healthcare has gone through a rough patch
Mhm.
over the last 5 years with COVID, and I think a lot of providers are feeling sort of beat down and burned out.
Mhm.
But I'm excited as all these products um, help clinicians do their job more efficiently, more accurately, better outcomes, lower cost. You know, everybody can start to feel good again about healthcare and have trust in healthcare, and from a clinician level to the patient level, to our country.
Mhm.
Um, I'm I think there's a bright future for healthcare.
I love that. And just kind of actually just like my sentiment is kind of a culmination of everything that you guys talked about, which is kind of this like speed of diagnosis, which is good for patients, good for providers, good for costs, good for outcomes, good for America and the world, all that sort of stuff. And like AI, as I've been working on it for 8 years, I've worked with a lot of companies. I think I worked with 30 startups last year alone, and it's really inspiring to see how, I mentioned on a mental health panel yesterday that we are all wrapping our arms around this big, hairy challenge to try to solve it. And I think the future is very, very bright, which is exciting. And I think we actually do have a couple of minutes. I don't know if there's anybody in the crowd that has questions. We didn't do questions yesterday, but AI is a fun topic. So if anybody has questions.
Yeah, I'll talk to that a little bit because one of the things that we do is project management implementations. And 8 years ago, we were implementing computer-assisted coding solutions that would do exactly that. They would go through and say, okay, here's the codes that you have, or actually, here's the diagnosis, here's the corresponding codes. And we looked at the medical record, and it's not supported in the medical record. Flag it to the nurse, flag it to the doctor. This needs to be taken care of before we submit the bill, even. The problem was, I think it cost $580 million for us to implement it at the time. So I think that's one of the advantages we see now with this expansion of AI is making those kind of solutions affordable to your non-nationwide
Mhm.
health systems.
Yep.
Yeah, I think if you go back to that American Medical Association report, they had about 20 different topics, and the one that on the very top is coding and billing automation and documentation automation, um, because right now everything in healthcare runs off of the documentation, and it's a huge burden. And the more that we can automate that, there's now ambient documentation. Physician goes in the room, talks to the patient, they walk out, it's all documented and coded, and that's going to allow those things to get caught faster, and make sure that gaps like that don't happen going forward. But it's a huge problem. I mean, my son broke his arm a few years ago. I'm still getting bills from the orthopedic doctor 2 years later. I'm like, I thought I paid this.
Yeah.
So that is one of those areas.
Imagine having a baby.
Yeah.
Get all those bills.
And I've spent a lot of my career in like that side of it's actually, it's kind of the revenue cycle side. And that's why I continue to say that when we think about AI in healthcare, it's like it's never going to replace everybody. We still need human touch on things, but what we're doing with AI is actually eliminating the things that don't need human touch so that somebody can go in and it's still going to be a little bit manual, but like that's when we're putting like the super high focus on, and especially on the care side, it's like practice medicine at the level that you're trained to do rather than these sort of, I don't want to call it mundane and like little things, but like we're actually like enabling people to do the work that they're done for. So like the fatigue side, I think Z, you mentioned fatigue earlier, maybe it was Adam, you. It's like these people that are doing coding and billing and looking through reams and reams, I refer to it as the paper towel roll, like 70 different pages in the EHR to figure out what's the right code. We're not there yet, but I think we are getting there. But that's an omnipresent problem, especially with timely filing requirements and stuff like that. So
Yeah, an example I gave in a panel I sat on yesterday was Excel. When Excel came out, everybody thought accountants were no more. We don't need accountants anymore. What, in fact, haven't we still have accountants? I'm sure everybody here knows. But it freed them up from the, right list, left list, black, red.
Managing a ledger.
Yeah, managing a ledger to, okay, we've got this really complex problem that I'm going to enjoy solving, and now I can spend my time doing that because Excel's handling all that other stuff. I see the same thing coming with AI.
yeah, I love it.
It's a great example.
I love it.
Yeah, one thing that I think is a step change with coding that could really help you in something like that if you're trying to make a case for why it was valid or not is if you have large language models, it's not just this discrete thing of like I read lymphoma and then it's this code. You actually get the whole story of the disease if you're doing it correctly. So you can figure out why the person came in that day, what's been seen since. Or sorry, why the person came in the first time that was diagnosed, what's been seen since. The fact that we have all this connection means that you can see it across all the different places that they've gotten care in one view. So I think we're at a point where we're able to just understand more and more about a person in a more and more logical way, and that's kind of a step change that happened very recently.
Yep, love it. Any other questions? That was by the way, awesome one because everybody thinks about that stuff, especially Brian, as you mentioned, you're still getting bills. I think one of my physical therapists sent me a bill from like 5 years ago, and I'm like, look, I'm not paying this. But any other questions? If not, we'll wrap up. This was, by the way, like I know we all just met, but this was I listened to some panels today. I moderated one yesterday. This was awesome. Like I enjoyed hearing everybody's perspectives. Super unique from the security side, the clinician side, tech side. Like this was probably my favorite moment of the conference so far. So thanks for everybody for staying around.
Thank you so much again, guys. Another round of applause for our panelists shedding light on AI and its connection to healthcare. Fantastic. Still so much to learn in that realm. It's time to wrap up day 2 of the Health 2.0 conference, but